Hereditary ATTR amyloidosis is due to a genetic mutation, often passed down in a manner that we call as autosomal dominant. So if a patient has a genetic mutation, it's often passed down to their children, but it is not clear whether or not the child or family member of that patient will develop the disease. We don't always know if there's what we call 100% penetrance. Wild-type ATTR amyloidosis is often due to degeneration of the protein handling, which leads to the diagnosis of cardiac amyloidosis. And that tends to occur later in life, sometimes in the 70s, 80s, and 90s, whereas hereditary ATTR amyloidosis may start affecting patients as early as the fifth decade.
Indication and important safety information. Indication. Attruby, acoramidis, is indicated for the treatment of cardiomyopathy, of wild-type or variant transthyretin-mediated amyloidosis, ATTR-CM, in adults, to reduce cardiovascular death and cardiovascular-related hospitalization. Important safety information. Adverse reactions. Diarrhea 11.6% versus 7.6%, and upper abdominal pain 5.5% versus 1.4% were reported in patients treated with Attruby versus placebo, respectively. The majority of these adverse reactions were mild and resolved without drug discontinuation. Discontinuation rates due to adverse events were similar between patients treated with Attruby versus placebo, 9.3% and 8.5%, respectively. Laboratory tests. Mean increase in serum creatinine of 0.2 and 0.0 milligrams per deciliter, and a mean decrease in eGFR of 8.2 and 0.7 milliliters per minute per 1.73 square meters was observed in the adults with ATTR-CM treated with Attruby versus placebo, respectively, at day 28 and then stabilized. These changes were reversible after treatment discontinuation. Use in specific populations. Pregnancy and lactation. There are no data on the use of Attruby in pregnant women. Animal data have not shown developmental risk associated with the use of Attruby in pregnancy. There are no available data on the presence of Attruby in either human or animal milk, or the effects of the drug on the breastfed infant or maternal milk production. Please see full prescribing information for Attruby at attruby.com/PI.